Hi, I'm Dr. Patricia Bueller, and I'm the CEO of Osheru, which is the maker of Ziplyft. Ziplyft is to do upper lid blepharoplasty without any bleeding or suturing. Today, I'm going to demonstrate how to use the Ziplyft device using chicken skin as a stand-in for human tissue. The chicken skin is very similar to human eyelid skin. The device arrives in a white box, and inside you'll find a sterile peel pack that contains 2 devices and the forceps. You open the sterile peel pack onto the field. You get 2 devices, and they each have a handle on them and a blade that slides across. The white-handled one has an R on it, and it is to be used on the right side of the face, and the blade needs to be temporal. The left device has an L on the blade slide and it has a black handle, and the blade also needs to be temporal. You'll also need a sterile Derma bond applicator, as well as a sterile skin marker and ruler, just like you would have with a standard blepharoplasty. For this demonstration, we have chicken skin that we've placed over the top of this head model today. We place it so there's a little redundancy over the eyelids. And this is a great way to practice with the Ziplyft and also to train surgeons and sales reps. First, we're going to do the markings. Right above the nose in the center, we're going to place a central mark. Then we're going to use our ruler, and we put the ruler at about 40 millimeters and put a mark at 0 and 80. And that's to give us symmetric markings above the brow of the patient. The Ziplyft device has indentations, so you can make sure you have the 2 devices on symmetrically. We're going to use the marking pen to simulate a mark for the lid crease, just like you would in a normal blepharoplasty. So we're marking that lower crease on both sides. The length of the incision is about 40 millimeters across. We use the green forceps to bunch the tissue up. And then we're going to do another arced marking of the upper length of the incision. We're going to do that on both sides symmetrically. So the overall incision is about 40 millimeters across and about 12 to 15 millimeters in height in the central area. So for the right-sided device, we're going to use the device that has the R on the blade glide. And we're going to lift and bunch the tissue and then grab the tissue and bring all the marked excess skin into the jaws of the device. Once we have all the skin in the device, we're going to close the device. We're going to do it slowly to allow for the excess fluid in the tissue to eke out a little bit. So we're going to slowly close the device, and when it gets completely closed, it's actually going to click into place and lock with this little latch. Similarly, we're going to put the other device symmetrically on the left side. You can see where the brow marking is on this side in relationship to the 3 dots on top of the device. And you want to place the second device on symmetrically, looking at the notches on the device and the notch above the brow. We're going to go ahead and close this device. You want to make sure that you have about the same amount of tissue on each side, but if there is more tissue you want to remove on one side than the other, you certainly can do that. You just want to make sure you have all the marked skin in the locked jaws. We're going to slowly close and lock that second jaw. The purpose of this step is to create the Ziplyf seal, to cut off the blood supply to the tissue so there's no bleeding and no need for cautery. Once it's been on for a minute, now it's time to cut. You take your non-dominant hand to brace the device, and then we're going to push the device blade across the device to cut the skin tissue. And it's sliding very nicely across here. You can pull it up to keep it on stretch to get the device all the way across. Once the device is all the way across, and located nasally, you can just pull the tissue against the blade to get it completely cut. And now we've removed that right excess upper eyelid skin. And we'll turn and do the same thing to the left side. It's good to push the blade handle down towards the jaws to get the best cut possible. And we slide the blade across. You can put a little tension against the chicken skin. And we have a complete cut, and we remove the tissue. Then we leave the devices on for 5 minutes to assure that we've got a nice seal and there's no bleeding when we remove the device. Once that's completed, we're going to remove the device by carefully releasing the jaws by pushing down on this latch. When we remove the Ziplyf device, there's a sealed ridge of tissue. And we remove the second device. And again, you have a nice sealed ridge of tissue on the other side. Then we're going to apply the Derma bond. You open the Derma bond sterile peel pack. And once you have the Derma bond open, you're going to crack the seal in order to activate the Derma bond. And then I usually recommend that you use it on the drape next to the patient to just make sure there's no initial blob that sometimes comes out with the Derma bond. And we're going to use the Derma bond to put adhesive all across the incision on the right side and the left side. And I usually have the assistant hold a Q-tip next to the nose just to be certain that no Derma bond kind of runs into the eye itself. If there's any Derma bond off to the side, you can also clear that as well with a Q-tip. If there's any bleeding, you can add a little bit of additional Derma bond if you need to. The Derma bond takes approximately 1 minute to dry. Once 1 minute is over, the procedure is actually complete. And we usually ask the patient to open their eyes wide and close their eyes tight and raise their brows just to be sure that the incision is completely intact. At that point, we're finished with the operation and the patient can go into the recovery area where you can place ice right over the incisions that have adhesive on them. And that ends the procedure. The patient can go into the recovery room and can put ice on right over the top of the adhesive. And again, there's no need for any ointments. Thank you for your attention.